Connor Meadows primary survey audio recording verbalizes general impression. BSI and Scene Safe are complete. I'm now going to ascertain the general impression I get from the patient based on the patient's outward appearance. Determines responsiveness level of consciousness. Based on my interactions and communications with the patient, or lack thereof, I'm going to determine the patient's LOC. Determines chief complaint, apparent threats to life. At this time, I am going to be relying on the patient to tell me their symptoms. If the patient is unable to communicate, I am going to have to deduce what is wrong using my senses. Additionally, I can talk to caregivers, bystanders, and others to determine what the patient said or how they were behaving before we arrived. Finally, if there is an immediate threat to the patient's life that I can fix right away, I will go ahead and do so. For instance, applying a tourniquet or performing other emergency actions if necessary. Assess airway and breathing. At this point, I'm going to take further note of the patient's breathing and airway behavior. I'm going to be looking for the use of accessory muscles, nasal flaring, and other things. Based on that, depending on what I see, I may decide to place the patient on oxygen. Assesses circulation. If there is bleeding of any serious nature that has not already been handled by direct pressure or tourniquet, otherwise, I will go ahead and treat the bleeding. Furthermore, I am going to be observing the patient and looking at capillary refill, as well as taking a pulse. I will also be feeling the patient's forehead to assess whether the patient is running a fever. The patient's perfusion will give me a basis for how I treat the patient from this point forward. Assess disability. At this point, I should have noted any obvious deficits, but I will go ahead and recheck the patient for any obvious disability, and if something is noted, I will try and determine its origin and how long it has been present. Exposed for examination. The patient will be exposed for treatment if necessary. I will explain to the patient what I am doing and for what reason they are being exposed. I will take special sensitivity to patients of the opposite sex and make sure and explain to them the procedure. Priority patients make transport decision. At this point, I will determine, if I have not already done so due to emergent circumstances, whether or not to transport the patient immediately or continue to treat the patient in the field.